It's Tuesday and it's time for some tips. I'm Dr. Heather Stanley, your pregnancy specialist, and I'm going to give you 3 tips on how to live and manage RA. What is RA, you ask? It is an acronym for rheumatoid arthritis. This is where your immune defense system sort of gets some misdirections and decides that it's going to attack native cells. Now, in this particular instance, the immune system attacks the synovium, which is the lining of the joints. And over time, you get pain, stiffness, swelling, and if it isn't treated, then you can get loss of the joint function. In pregnancy, RA activity can be affected by the pregnancy, and it pretty much depends on how severe mom has the disease. Some women, most women in my experience some relief during the pregnancy from RA, but there are some who have flare-ups, and the flare-ups may be mild and easy to treat. So what do? Number 1, we have to keep those joints moving. So we don't need high impact exercise, but low impact exercise such as walking, yoga, tai chi. If you have a bicycle, get that helmet on and do some cycling. Pilates. A lot of these things, walking is free. You don't need extra clothes or fancy paraphernalia for that. Tai Chi you can find, yoga you can find on YouTube. So don't let the expense, don't let that slow you down. But seriously, 20 minutes a day of some activity, movement activity, is going to help with your symptoms. It's not going to get rid of it, but it's going to help it. Number 2, look at your diet. Avoid high cholesterol, saturated fats, and sugars. In other words, things that tend to be inflammatory, you're going to want to avoid. You're going to want to cut them out. Antioxidants, foods that are high in omega-3 fatty acids are all diets which are helpful in reducing inflammation. There was one study out looking at the Mediterranean diet for rheumatoid arthritis, and it was helpful. It didn't prevent. Now, we're not talking about prevention, because if you have it, it's kind of there to stay. But if you reduce your inflammatory intake of food, the food that's inflammatory, then you can get some relief from your RA. Last but not least, stress reduction, rest. If you want to hear more about stress reduction, follow me. My name is Dr. Heather Stanley, and I would like to invite you to please go on my website, sign up for my email. The website is unitymfm.com. Drop your email so we can send you tips, important pearls, newsletters, events, things that are going on. You can also find me on social media at Insta, at unitymfm. or on Linktree. All right. So I am off to work. Breathe. I will talk to you tomorrow.